The World Health Organization has released its excess COVID death and mortality burden of various countries. Globally, the WHO says that about 15 million deaths have happened due to COVID-19 in the pandemic years. What does this mean? How does their data projection and modeling studies impact nations? Because India, as is being looked at, is perhaps having the highest death toll, excess mortality toll globally. So joining me now is Dr. Amita Gupta, who is the director and head of the Division of Infectious Diseases at the Johns Hopkins University, the School of Medicine in the US. Dr. Gupta, thank you so much for joining me. Want to understand how does WHO look at the excess mortality data through a modeling study?
Yeah, so thank you for that question, and thank you for having me, Milan. So typically each year there's an estimate of number of deaths that have happened, and they have a world mortality data set that's used. And it's gleaned from a few different sources of data that different countries share from their, national and local statistics that they collect, because death obviously is a reportable to the society, and so those get collected. And we have data from before COVID, and then we have now data during COVID. And what's been clear is that it's been a challenge to accurately collect data actually across the globe. During a pandemic, there are people who died in their home, there are people who did not seek care. And so we have data that's incomplete, if you will. And so each country has had a challenge with sort of complete accuracy, but there's been variable degrees. And I think the challenge here is that it seems that there's, some countries have done a better job than others in terms of accurate reporting. And in the case of India, it does appear that the estimates suggest a much larger toll than that what's officially reported.
But how do you see it in terms of the fact that the WHO themselves said that there was problem in collection of data from various countries? Now, I'm not saying that India did not face these challenges, but the estimation of what India has reported, more than 5 lakh or 0.4 million or deaths, to about 47 lakhs or 4 million plus deaths. That's what the WHO is reporting. The difference is humongous. And that is why the questions of why this particular modeling study is something that we could depend on.
Yeah, I mean, of course, that is a large difference, and there's no doubt about that. And I will say that there have been a few different groups that have tried to look at excess mortality by either individual countries or regions and have all found some type of multiplier. It does come down to the methodologies and whatever is the available data source and the type of models that are being used. I think we can all agree that there's definitely a multiplier. So whether it's 9-fold or 4-fold or 3-fold, I think, there's a range even around the estimate of about the 9.5-fold, right? There's a lower estimate and an upper bound estimate for that. Yes. Listen, I think part of the issue is that it is hard during a time of true crisis. And we know when the Delta wave happened, it was truly a crisis of astronomical proportions. And so accounting for people dying when you're having to make funeral piles, out on the streets and sort of managing that, and who had the time to understand how many people were passing away at that time. So I think that what was officially collected and what's been modeled, the truth lies likely somewhere in between, and exactly at that point estimate is as good as the WHO has tried to estimate based on prior years and the data that was shared with them. And so some of it has relied more on modeling, whereas others have relied more on actual data that was shared. And so I don't have all the information of the exact nuances of what they used for the India specific data, but I think that we can rest assured that there is definitely with all the countries looked at, there's been some underestimation.
But what of Johns Hopkins' own estimation on the toll of deaths that have come from COVID-19, because Johns Hopkins also does these studies, modeling studies in prediction of the COVID peaks across the world and in countries as well. So what do your studies suggest? Are we closer to that number, or is there still either an under or overestimation?
Yeah, well, I think that, so with respect to our studies, I mean, I think we have done some estimation. We haven't done sort of a full global estimation across the board in this 2-year period in the same way that the WHO did. But we, as I said, there has been across the board underestimation of COVID deaths. Now, remember, it can be due to 2 reasons, either a direct cause or an indirect cause, because people are not showing up for care, whether it's for their heart disease, their diabetes, they have pneumonia not due to COVID. So there are many different reasons as to why there can be a death. And what we're reporting is the totality of that. Those that are due to COVID and those due to other causes because of delay during the pandemic and all the lockdowns where people weren't coming for care. I do think that we can strengthen our estimation by actually doing field work and going and doing door-to-door surveys. Like when we do the census, for example, we can actually collect data that can provide, in this year, how many people in your household died. In 2018, how many people do you know that died? And you can start to really look at that multiplier. And if you do the sampling well, that would be the best way to really get at the estimate, right? So we can actually use real data from a well-designed, sampled population where, you can say, everybody can remember when a death happened. So you could actually use that approach to collect robust data to strengthen the actual multiplier.
Dr. Gupta, also, when you look at the data from the WHO, India stands with countries such as the USA, Russia, and other countries at the top of the list that have had excess mortality. But when it comes to China, the WHO reports that China's COVID excess mortality estimates are in the -2. And how does that work out for countries that are actually bringing out that data, but countries like China that never do?
Yeah, so data transparency and data accountability are incredibly important. And, there's probably 2 things to the story. And I honestly, again, I was not at the table when they made these estimates. And so I don't have all the thinking around the processes, but we do know, at least for China now, is having a much more impactful COVID, impact of COVID, right? So they had done an incredible job early on with their lockdowns. They were severe, but they did sort of manage to control the pandemic in the 2020. And so their numbers are likely to be quite different than what we see in US, Brazil, India, Russia, France, Italy, UK, et cetera. Where we know that the policies have been different. There's huge populations, people are mixing, people are not masking, the vaccination rates were variable. So lots of factors coming into each country's scenario. But it's true, we don't have not all countries have the same data transparency and sharing as others.
So in that case, how does it work out for countries that don't really share data and are not really questioned on the fact that their data is not robust enough? WHO themselves has done a modeling study. So shouldn't their modeling predictions for China be similar to what they are for, say, a UK or a US or Brazil or for India? Because their projections also don't show that there could have been some amount of excess deaths when it came to China as well.
Yeah, well, I think that it'll be interesting to see what 2022 shows, because they've been, particularly Hong Kong, China, these areas have had a particularly severe, first quarter of 2022 with their COVID infections. And so, but they've also, benefited from vaccination. So unlike in 2020 and 2021, when many countries did not have much vaccination and had severe variants and very quick peaks that were very high, I think the time will tell. I think with China, we will have to see what this year shows with the modeling and the impact of COVID, because they did have a different strategy and different sort of number of infections the first 2 years of the pandemic compared to these other countries you've mentioned.
So is WHO working on a different scale of data for the year 2022? Because their prediction and their modeling efforts may have been true to what they have presented in this particular data. But are you saying that they may change with more and more countries now coming out or either objecting or agreeing with the data set that they're putting forward?
Yeah, so I think with any data is dynamic, and so data is evolving, and different countries have different impacts over time. There are a lot of factors that go into a death rate, and as I mentioned, it's the health of the population, the age of the population, how much of the risk factor for progressing to severe illness and death, what kind of health capacity they have, vaccination rates, right? So I think the WHO data in terms of one, hopefully we'll be able to take studies that will be done with, looking at field data and actual estimates that are coming from household-based surveys, for example, as well as looking at their parameters that they used in the models. And these are things that get done routinely each year. I mean, these data sets, and they can only be improved. There's no data that's perfect and no set of assumptions for any model that's perfect. But they do tend to get better over time. So I do think they will continue this exercise, and each year or each 1 to 2 years, there'll be a lot of interest. The pandemic's not over, and there will be an estimate to look at excess deaths over each year from here on.
Is Johns Hopkins also working on a similar data set to look at global excess deaths throughout the pandemic, and not just 2021, 22 also?
Yeah, we're looking, well, there are a few different groups looking at various impacts of COVID, not just on excess deaths, everything from impacting childhood vaccination, all the disruption that's happened to immunization, looking at the healthcare, the disparities in outcomes and care. So indeed, there are groups that will be looking at excess mortality, but there's also other, we're also interested in modeling other impacts of COVID on society's well-being.
What would be these other impacts, if you could elaborate, Dr. Amita?
Sure. So I was mentioning, for example, disruptions in childhood vaccination, immunization. So we know that COVID has had huge impact on children getting vaccinated for routine childhood vaccination. So, for example, we're looking out for what's the estimated, what could be an estimate of measles outbreaks based on the number of kids who've been vaccinated with or didn't get vaccinated with their routine MMR vaccine, which covers measles. We're looking at things like access to safe deliveries. So how many women who were pregnant who couldn't get to a healthcare setting where they could have a safe delivery. Looking at healthcare disparities and access to vaccines and other care, whether it be just care for diabetes, care for preventive care services, how much of that has been disrupted. TB, another area, we know that tuberculosis, sadly, systems were very much disrupted, so people weren't able to get all of their medications or get a timely diagnosis. And there have been both global and local estimates to see how much tuberculosis we anticipate seeing over time. So these are some examples of modeling that's occurring at looking at both direct and indirect effects of COVID.
Are you looking at another wave of COVID infections in the coming times? Because as we speak, South Africa is reporting more than 30,000 cases once again. And even in China, that continues to be in a lockdown situation still. Now we're looking at a burst of cases in mainland China, Shanghai, as well as Beijing. Also some cases being reported from across Europe and once again in India as well.
That's right. So we are seeing new waves, and we are anticipating additional waves. The reality is that we also know that the vaccine has waned, has waning immunity, and we are still learning how long is the full protection. We also have the virus evolving. So new variants are arising. Some are far more transmissible than the original variants. We know that from Omicron and now these new variants, as you mentioned, in South Africa. So the pandemic's not over, and yet we have policies that are being put into place. In this country, people are not wearing a mask on airplane rides anymore. Restaurants are open. You go into a restaurant in India, it's only a small proportion of people are masked. When you're in some public transportation, most people are unmasked and gathering, whether it's in the marketplace. So plenty of opportunity for both the virus to evolve, for us to for people to be transmitting to each other. And until we have full herd immunity, as well as understanding of how often we're going to have to give the vaccine and evolve the vaccine, we're not out of the woods yet, unfortunately. I wish I could say the pandemic is over, but it really isn't yet.
So which month are we expecting to see a wave, and how soon can we expect to have this herd immunity become a reality for us?
Well, and it's interesting because in a lot of places we know that when we've done these sero surveys, including in many parts of India, there are parts of India where up to 90% of the population has an antibody that's positive.
Right.
But exactly how long that protects you from, reinfection, we know reinfections happen, right? And that's where getting the booster vaccine, even if you've had prior COVID, we're still recommending people to go get vaccinated. But we still haven't quite figured out how often do we need to keep boosting. Like for flu, we know annual, we have to do it every year. We have to do a flu vaccine. So we're still figuring that out with COVID. And I wish I could look in here in my magic ball. It tells me when we're going to have the next wave where. Now, the reality is, I think we're going to see right now in the US, infections are ticking up again as well. Each day, I see it rise by 2,000-3,000. We're at 65,000 and counting. In India, I've seen that it's now rising as well. It's a question of how high that peak will go. As I said, several factors. And I wish our models at this point sort of do an okay job of modeling out to about 4 weeks from the time we're looking. Things beyond that become really hard to model, given this is still uncharted territory.
And the herd immunity.
So the herd immunity, I mean, in some ways, some places have achieved herd immunity, greater than 80% have been infected, or they have a huge proportion of population that have been vaccinated, greater than 80%. But again, what that means is that hopefully that tampons down the risk of going on to develop severe disease. I think with some of these more transmissible variants, you can still get the infection. So we need to be able we're on the lookout for which variants cause severe disease. And hopefully in places where we've either had a large burden of infection or really good vaccination or both, that protects a population from then ending up in the hospital or dying from the infection. And we know that already. Omicron had a lot more infections, but fewer deaths than what we saw during the Delta wave, for example.
And would you say that India has attained some percentage of herd immunity?
Yes, I think it has. And I mean, again, the sero surveys sort of have shown how quickly that increased from a really low percentage to now in parts where 80-90% of certain populations have been infected, at least have a positive antibody. So, in certain places, yes. But again, this is a new infection. Clearly, reinfections happen. So even with the concept of herd immunity in some geographic areas, doesn't mean we're completely out of the woods, depending on what this virus does with its evolution.
All right, Dr. Amita Gupta, thank you so much for speaking to me for India today. And we'll wait to see when we can reach herd immunity. And meanwhile, talking about COVID excess deaths of WHO, India still objects and will continue to present some data from its end as well. Thank you so much.
Great. Thank you so much.